Good afternoon, everyone. I myself, Dr. Shraddha Bhadane, and I'm from Sherpur. Now, today we are going to discuss about the toxicology, which is a very important branch of the forensic medicine. Okay, so toxicology is nothing but actually a branch of science which is dealing with the properties, then action, then effects, sources, characters, and fatal dose of the poison, right? So Matthew Joseph Orifla was the first person who is doing the correlation, or who has done the correlation in between the human body and the chemical substances. That's why he is known as a father of toxicology, right? So toxicology, so many toxicological branches are there, like environmental toxicology is there, then ecotoxicology is there, then occupational toxicology is there, right? So many branches of the toxicologies are there, but we are interested in the forensic toxicology. Forensic toxicology is nothing but the study of the poison in a legal or the medical way, in which the poison is acting on the human body, right? So forensic toxicology, we are basically concentrating on the term poison, right? Poison is a substance which, when introduced in our body, is able to cause the death or disturb the physiological functions over there. Okay, so this poison's definition is varying, means it is if we are viewing the intention of the person with which the person is giving the substance, can termed as a poison, or it can be termed as a drug. For suppose, or for example, if the person is giving some substance to a person with the intention to heal the person, or with the intention to treat the person, then this is known as a medicine or drug. But when the same substance is administered by someone to deal with the or to cause the death or to cause the harm to the enemy, then so if the intention is varying, then the same substance may be termed as a poison over there. Okay, so this poison is a very broad term, and depending on the intake or severity or the source, the types of poisoning also differs, right? So first of all, when we talk about the types of poisoning, depending on the intention, it may lead to the accidental as well as intentional poisoning, right? So depending on intake, what intake you are giving or what type of poisoning you are facing, it may lead to the accidental and the intentional poisoning. Depending on the source, it may lead to the mechanical poison, household poison, and industrial poison, right? After that, depending on the severity, the poisoning may vary, like acute poisoning, subacute poisoning, and chronic poisoning. In case of acute poisoning, the substance, when given in a very large dose, the person is able to produce so many symptoms in a very short period of time. Okay, and this severity is may be very high, and the morbidity or the mortality rate is also high in case of the acute. Okay, then in case of chronic, the drug or the poison is given in a small doses for a period of span. Okay, so for that, the gradual deterioration may happen inside of your body, and leading to the effects which are very long-term effects. Leading to the long-term effects is known as a chronic poisoning, and the intermittent in between the acute and the chronic is known as the intermittent or subacute poisoning over there. Now, the classification depending on the medical purpose is are the suicidal, homicidal, accidental, stupefying, abortifacient, cattle poisoning, arrow poisoning, and the uh, food poisoning will be there, right? So suicidal poisoning is the poisoning in which the person is attempting to kill himself. Okay, then homicidal poisoning in which the person is able or trying to kill other persons, right? So after that, accidental poisoning, in this the person will feel or will face the poisoning condition by chance, right? For example, those persons which are working in the industries, or for them if the chemical substances is ingested or some poisonous gases are inhaled, then at that time those workers may face the accidental type of poisoning. Then stupefying poisonings are the substances which are causing the temporary subconsciousness or unconsciousness of the person, right? Abortifacient are the substances which are leading to abortion, leading to cause abortion of the pregnant woman. So in that, so many oleander or calotropes might be the substances which are acting as a abortifacient. Then cattle poison. This type of poisoning, the poison or the substance that is given to the animals, okay, to take the revenge of the enemies. These poisoning can be done by doing the soy poisoning, right? In our book, soy poisoning is given. Abris ticatorius is the main substance which can lead to the cattle poisoning over there. After that, arrow poison is there. Now in arrow poisoning, what happens that in olden days so many persons are hunting for the animals to take the skin or the horns of those animals and to prepare the decorative items in their profession. So arrow poisons are also there, in which abristicatorius, calotropis, castor oil, these are the substances which are utilized for the arrow poisoning over there. And after that, food poisoning is there. In food poisoning, so many substances like so many microorganisms which are overgrown in the food which is not fresh or which is kept for so many days, then these microorganisms, when we consume that food, these microorganisms produces the disease condition in our body. Okay, after that, drug dependence is there. In drug dependency, so many persons are very much dependent on the drugs, like drug addicts or alcoholics, means they are feeling well only when they are taking these substances. This dependency is known as the drug dependency over there. After that, we are moving to another subject, that another thing, that is the classification or classification of the poisoning depending on its action over there. Okay, so depending on the action, the first is the corrosive poisoning. Okay, so in corrosive poisonings, first type is the corrosive poisoning. In corrosive poisonings, again there are two types. First is the acid, second is alkali. In acid, again two types are there, that is inorganic acid and organic acid, right? In inorganic acid, so many acids like sulfuric acid, nitric acid, hydrochloric acid will come. After that, in organic acids, so many acids like carbolic, oxalic, acetic acid will come in that. After that, alkalis are the hydroxides and carbonates of sodium, potassium, and ammonia, right? Sodium, potassium, and ammonia will be there. Okay. After that, second poisoning is known as the irritants poisoning. Now, in case of irritants, again there are three types over there, right? In three types, it is inorganic, organic, and mechanical. Okay, now in inorganic also again two types are there, that is metallic inorganic poison and non-metallic inorganic poison. Now in metallic poison, what happens, so many metals like arsenic hai, lead hai, mercury is there, copper is there, these metals are acting as the poison in this group. After that, non-metallic poisons like phosphorus is there, then phosphorus is there, then uh, iodine is there. Likewise, these substances are the non-metallic inorganic poisonings. After that, organic irritants are again divided into two. These are vegetable poisons and animal poisons. In vegetable poisons, so many vegetable like Abies picatorius, cannabis indica, then after that, oleander is there, calotropis is there. These substances will act as a vegetable organic irritants. In animal group, the snake poisoning, yeah, where scorpion poisoning will lead to the animal branch of the organic irritants. After that, mechanical is the last irritant group, and in mechanical, powdered glass or the chopped hairs may act as a mechanical irritants over there. Okay. After that, the next classification or the next type is the systemic. Okay. In systemic, we are responsible for, or we are interested in different systems. Okay, some of the substance which are having the affinity for certain systems only. So likewise, we are interested in different systems in this type. Okay, so cerebral is the first one. Cerebrals means those substances which are able to act or which are causing the effect on your brain. Okay, so in this group also two types are there. Cerebral depressants are there and cerebral stimulants are there, right? So in depressant, those substances which are causing the depression of overactivity of your brain will be included, like anesthesia, anesthetic substances, analgesic substances may come in this group, or alcohols, sedatives. These are also the other substances which are included in cerebral depressant group. After that, cerebral stimulants will come. In this group, caffeine or antidepressant will come, or amphetamine is again the other chemical which is included in this cerebral stimulant group. After that, spinal will be there. Okay, so in spinal means those substances which are able to cause the effect on your spinal cord. Now in this, nux vomica is the principal drug which can act as a spinal poison. After that, peripheral means peripheral जो है आपके जो माइक्रोवेस्कुलेचर उस पे कॉन्टैक्ट करेगा. So conium may be the drug which can lead to the conium or curare. These are the two drugs which are uh, included in the peripheral poisoning. After that, cardiac is there. In cardiac, those substances which are having effect on the heart. Okay, so heart के लिए jasimium, aconite, tobacco, these will be included, or oleander is also included in your cardiac poison over there. After that, asphyxiants are there. Asphyxiants are only the gases which are causing or which are able to cause the ill effects on your respiratory system. So in this, carbon monoxide, carbon dioxide, these gases will be included in the asphyxiant type of poisoning. And the last but not the least is the miscellaneous type of poisoning, in which food poisoning is included. So food poisoning, botulism is a very common microorganism which is causing the food poisoning in your poisoning or in your toxicology, which is included over here. Okay, so with this, the classification of poisoning is over. Now we'll see what are the routes of administration of poisoning. Okay, now according to the severity, so many routes of poisoning are there, but which is the fastest route of poisoning or route of administration of poisoning, that we'll see. So first is the fastest is the inhalation, right? So inhalation of the poisonous gases will be able to cause the fastest effect on your body. Second one is the injection on your intravenous. Okay, intravenous injection is the second one. Like those who are taking the drugs, they are taking through the injection only. Intravenous injection is the second route of administration. Then subcutaneous is also the route. Then intradermal is also the intradermal injection is also a route of administration. After that, applying the poison on the wounded area, broken skin will also absorb the poison very fast. After that, the intake means ingestion, that is taking the poison through the mouth. Okay, it will take a little bit of time, so that it will go in the stomach and then it will be absorbed in the peripheral circulation. So ingestion is there. After that, giving the poison through the rectum is also one of the types of or mode of administration of poison. After that, the application of the poison on the intact skin, means non-wounded skin, is also there, but it will take a long time to absorb, means it is the least type of poisoning over there. Okay, after that, we are interested in, or we'll see now, what are the treatments of the poisoning. Okay, now in treatment of poisoning, the first one is the ABCD of the resuscitation. What is this ABCD of the resuscitation? So it is a very starting treatment in case of the severe conditions, in case of the acute poisoning or severe poisoning. When the patient comes to you, will first do the ABCD of the resuscitation. With this, the person might be recovered, or so many patients are recovering through only ABCD resuscitation. What is this ABCD? A is denoting for the airway cleaning and opening. In this technique, airways are cleaned up or opened up with the help of aspiration or lying down posture, or the postural aspiration जिसको हम लोग बोलते, postural drainage जिसको हम लोग बोलते हैं. So aspiration or drainage के जरिए we can open up and clean up the airway. After that, aminophylline can be given as a if there is a severe bronchospasm will be there, then aminophylline injection can also be given. Okay, so opening and cleaning up of the airway passage is the first A. That after B, B is for breathing. Means if arterial blood gas is not maintaining the oxygen level, then you have to give the additional oxygenation with the help of oxygen therapy, right? So additional oxygenation can be provided to the patient after opening the airway with the help of venti mask, or intubation can be done. After that, or venti mask or hood can be applied over there. Okay, after that, third one is the C. C is for circulation. To maintain the adequate circulation, we are always giving the IV fluid through the saline. Okay, so this is also very important to prevent the hypovolemic shock in these patients. Okay, after that, D is there, means CNS depressant. Proper CNS depressant should be given to the persons who are in a highly stimulant stages. Okay, so proper CNS depressant can be given whenever it is possible, means sedatives or analgesic we can give to them. Okay, so this is how the ABCD of the treatment, this is the first one. Now second one, the treatment for the ingested poison. Right now, treatment for the unabsorbed poison. जो poisoning cases when they are coming, or when they are brought to the hospital, then within 3 hours we can do these techniques, or we can follow these techniques, right? So first one, in unabsorbed poisoning, for inhalation. अगर poisoning inhalation के जरिए हुआ है, then we can take out the person into the fresh air first of all, and then second thing, we can clean up the airway with the help of aspiration or postural drainage, and give additional oxygenation to that patient. Okay, so this is the line of treatment, primary line of treatment for inhaled poison. Second one, when the poison is injected. Okay, injected poisoning में, in this technique we can tie a tourniquet or ligature just above the site of injection over there. So, and this tourniquet or ligature can be loosened every 10 minutes for 1 minute. After every 10 minutes we have to lose the ligature or tourniquet to avoid the gangrene. Then after that, that injected site can be sutured, or that can be cut and sucked out the remaining poison that is lying over there. Okay, so suction of the poison will be important, and after that neutralization of the poison will be there. After that, in case of ingested poison, we can do two things. That is, the gastric lavage or stomach wash is a very familiar name in case of the ingested poisoning. So the stomach wash can be done with the help of stomach tube, which is around 1 to 1.5 meter in length, with 1.5 centimeter in diameter, having glass funnel above, and with the help of this tube we can take out the ingested poisonous material in adults only. But for children, Rice tube can be used with the French catheter number 10 or 12. Okay, so Rice tube can be useful in the children which are facing the ingested poisoning cases, or which are facing the problem of ingested poisoning over there. After that, for contact poisoning, in case of contact poisoning, the substance which is applied to that area should be washed with plain water for 30 minutes is the only treatment. And afterwards, depending on the acid or the poisoning material, we can apply the soothing paste, for example magnesium oxide paste over there. Okay, after that, this is all about the treatment of the unabsorbed poisons. After that, we'll move the then for ingested, if stomach wash will is not possible, for so in those cases we can take the option, or we can give the option of emetics over there. Emetics means those substances which are able to produce the vomiting over there. Okay, so vomiting is produced by giving the emetic substances. Most commonly, ipecac powder or ipecac syrup can be utilized as a emetics over there. After that, after the ingestion one, we can move to the administration of the antidotes over there. Okay, now in administration of antidotes, so antidote is a substance which neutralize or nullify the action of poison. Okay, so many types of antidotes are there. First one is the mechanical antidote is there. Okay, now in mechanical antidote, activated charcoal, then demulcent, bulky food can be the options over there. Now in this activated charcoal, 60 to 100 grams can be given in adults. Then in demulcent, demulcents are the substances which are producing very protective coating over the gastric mucosa. Okay, so these substances can include the milk, starch, egg white. This will be included, or butter can be included in the demulcent group of antidote. After that, we are interested in the bulky food. Okay, so bulky food like banana can be given in this poisoning like powdered glass, so that the particles of the powdered glass will not able to make the injuries to the internal mucosa of the GI tract, so that the bulky food will enmesh the particles, and it can be removed through the evacuation over there, right? After that, we are interested in the second group of antidote is the chemical antidote. Now in chemical antidote, so many substances like acids will neutralize the alkalis, right? अगर alkalis का poison है, then acid can be given in a form of lemon juice, या फिर lemonade, या फिर citric acid combination. So likewise we can give, या फिर tannic acid can be nullify the action of the uh, so many acidic poisons, right? So so many alkali poisons, right? So and alkalis can be given in the acid poisoning over there. Okay, so this is all about the chemical antidote over there. After that, physiological or pharmacological antidote. Now, these physiological antidote are the substances which are able to act on the tissues of the body. Okay, so all the tissues of the body it is acting and it is working on the principle of antagonism, means they are able to produce the symptoms which are antagonist to the poison, which are exactly opposite to the poison. Okay, so these substances are known as a physiological antidote. For example, atropine and physostigmine are the best physiological antidote because they are acting on the nerve endings and able to produce the effect on the heart and pupils of the eyes. Okay. After that, last is the your chelating agents. Okay, chelating agents are the agents or the substances which are also known as a metal complexing agents. मेटल कॉम्प्लेक्सिंग एजेंट भी इनको बोला जाता है, राइट? सो मेटल कॉम्प्लेक्सिंग एजेंट, so many agents which can be given in the metal poisoning, heavy metal poisoning, like arsenic poison है, एंटीमनी पॉइजनिंग है, लेड पॉइजनिंग है, आयरन पॉइजनिंग है, मर्क्यूरी पॉइजनिंग है. सो इन केसेस में हम लोग ये चिलेटिंग एजेंट्स दे सकते हैं. विच आर दोज चिलेटिंग एजेंट? सो फर्स्ट इज अ BAL, that is British anti-levistic factor, which is also known as a dimercaprol, and it can be given in the 3 to 4 mg per kg dose. Okay. Second one is the EDTA. Okay, EDTA can be given in a dose of 10 to 12 mg per kg in case of the arsenic, lead, and mercury poisoning. After that, DMPS is there. That is the dimercaptosuccinic acid, 2,3 dimercaptosuccinic, propane, and 1 sulfonate. Okay, DMPS. This can be given in a dose of 5 mg per kg. डोज में हम लोग इसको देते हैं. आफ्टर दैट, DMSA, that is meso 2,3 dimercaptosuccinic acid. It can be given in a dose of 10 mg per kg. उसके बाद है penicillamine. This penicillamine can be given in a dose of 10 mg per kg. It can also be given in case of the heavy metal poisoning like arsenic, lead, and mercury. Okay, so after that, desferrioxamine is also there. It is the antidote which can be acting on the iron poisoning. Okay, or which can be helpful in the iron poisoning. Okay, so this is how we can treat the poisoning cases. After chelating agent, what is necessary? That is elimination of the poisons. Okay, so elimination of the poison by excretion is also very important, or this is also a mode of treatment. Okay, so excretion with the help of urine is the first one, means renal excretion we called it as. So this renal excretion can be done by giving the excessive amount of fluids or laminates over there, या फिर urinary alkalization also we can do, alkalizer also we can give. Okay, so that the so many poisonous substances can be thrown out with the help of urine. After that, purgatives is there. Purgatives means the substances which can be given and they can thrown out, which will exaggerate the throwing of the poisoning substances through the feces. Okay, so sodium sulfate 30 gram can be given for the to introduce the purgation in the case of poisoning, or या फिर जो है polyethylene glycol can also enhance the purgation in the poisoning cases. After that, diphoretics is also there. Diphoretics means it is the technique in which the toxic substances are excreted through the by producing excessive perspiration. Okay, so in this application of heat will be there, means application of wrapping the patient into the blanket or applying the hot water bottles will be there. This might be the technique to treat the person or to enhance the excretion of the toxic substances. After that, whole bowel irrigation is there, in which polyethylene glycol can be helpful for excreting the poisonous substances over there. So this is how we can achieve the excretion of the poisonous substances over there. After that, we are interested in so after that the after the excretion, the repeated or systematic treatment is also important one. In systematic treatment, whatever the remaining symptoms are there, like headache hai, vomiting hai, pain in abdomen is there. So that according to symptom you can give the drugs or you can give the treatment over there. So systematic treatment is also a types of treatment, or it is included in the treatment part. And after last but not the least is the follow up, regular follow up. In the follow up there might be the counseling, right? In suicidal cases, those who are having the tendency to suicide, to attempt a suicide, or homicidal cases may be psychiatric counseling जिनको लगता है, for those person it will be helpful to take the repeated and regular follow up, right? So with this, I hope that I am covering all the points of the toxicology. And the last and not the least is a thank you MUHS to give me the chance of delivering the lecture in and giving the chance to move ahead. One more point I like to share, that what are the factors that are modifying the poisoning, right? So there are so many factors which are modifying the poisoning. Like the first one is the form of poison. Some poisoning substances are in a different form. Like what is the physical form of that poison? If the poisonous is volatile, means directly going into the gaseous state, then it will able to act more fastly, right? फास्ट उसका जो है एक्शन होगा. Then liquid will be the second one, which will be able to um, cause the poisonous effect on your body. After that, third one is the solid. In solid also there are two types, that is the soluble solid and the insoluble solid. So obviously soluble solid will act more fast than the insoluble solid, right? So this is how the form of the poison is also important in, or can also modify the action of poison. Then second one is the dose of poison. The what is the dose, means whether it is a minimum dose, whether it is a moderate, or it is a maximum dose. So depending on the administration of dosage, it will be there that what can be the effect, what can be the ahead effect, right? So in that जो है आपका acute poisoning, chronic poisoning and subacute poisoning will be dependent on that, what is the quantity with which you are giving the drug. After that, mechanical combination of the poisoning अगर है, means suppose the strong acid is there, right? Suppose silver chloride and hydrochloric acid both are the very strong acids, right? But when they are combining, they are forming the salt, that is the silver chloride, which is not very harmful, or it is a very mild form of poisoning. So depending on the physical combination, that with which poison we are giving or we are taking, the effects are depending on that. After that, mechanical combination is there. Like means if you are giving the strong acid only 1 to 2 drops of strong acid, then it will be pro- able to produce very exaggerated effects over there. But same acid, when you are diluting in some of the solvent and giving to the person, then it may not affect that much, or it may not give the symptoms as much as fast over there, right? So this is how the depending on the mechanical combination, the poisons may act differently. After that, age is also a major factor of modifying, in which suppose the very small age group, right? Like pediatric age group, means those children which are under 5 years or under 10 years, those will suffer much rapidly, even with a short dose or very small dose of the drug if administered, right? And similarly, old age person will also suffer more rapidly even for the small dose of the poison over there, right? Okay, so after that, the factors which are modifying the techniques are age, dose, or quantity, how the poison and its nature are acting on our health, and depending on the so many factors